What is granulation tissue in cat wound healing? Have you ever wondered what happens inside your cat's body when it gets a wound? One important aspect of healing is something called granulation tissue. This newly formed tissue plays a vital role in how wounds heal in cats. Granulation tissue appears during the proliferative phase of wound healing, which usually kicks in a few days after an injury occurs. So what exactly is granulation tissue? It is made up of new capillaries, which are tiny blood vessels, and fibroblasts, which are cells that produce collagen and other materials that help in tissue repair. You will also find an initial framework of fibrin strands in this tissue. Granulation tissue acts as a foundation for further healing steps, such as wound contraction and the growth of new skin cells, a process known as epithelialization. In cats, granulation tissue tends to form more slowly compared to dogs. It usually develops from the edges of the wound and grows inward. However, you might also notice small patches of granulation tissue appearing across the wound surface. This tissue is often red and somewhat fragile because it is highly vascularized, meaning it has a lot of blood vessels. This is important because it supplies oxygen and nutrients that are essential for the healing process and helps to fight off infections. Healthy granulation tissue is necessary for wounds to close properly, especially in cases where the wound cannot be stitched up right away. It provides a scaffold for epithelial cells to migrate over, which is crucial for covering the wound. Since granulation tissue forms more slowly in cats, this can lead to a longer overall healing time. Epithelialization and contraction depend on the presence of this tissue. From a veterinary standpoint, encouraging the formation of granulation tissue is key to speeding up healing and minimizing complications. Proper wound cleaning and infection control are essential. Some treatments, like medical honey, can promote earlier and more extensive granulation tissue development. When it comes to bandaging, the approach may change once granulation tissue is present. Non-adherent dressings are recommended to avoid damaging this fragile tissue. In summary, granulation tissue is the new connective tissue and tiny blood vessels that fill the wound bed during the healing process. It is essential for skin regeneration and wound closure, but it forms more slowly in cats than in some other animals, which can affect healing time and treatment strategies. Understanding this process can help you provide better care for your furry friend during their recovery.